So we're going to talk about snotty noses and litter box problems in cats this evening. And because my interest is in how antibiotics are used in veterinary medicine and trying to improve that so that we reduce the risk of infections that we can't treat, I'm going to first give you an introduction on what antimicrobial resistance means and how it occurs. And then we'll dive into a few common conditions that we treat cats for with antibiotics, and some that we probably shouldn't. And so I'm going to provide that information for you. When should you be advocating for your cat to receive antibiotics, and when should we probably hold on those and provide other therapy? And then learn what your role as a cat owner is in terms of preventing antimicrobial resistance. So before we start on this journey, there are a few terms that probably are best to cover right from the start so that we're all on the same page. So when we think of things that cause disease, oftentimes we use terms like germs or bugs, and those include things like bacteria and fungi, things that cause diseases in both animals and people. Bacteria are single-celled organisms, and that's primarily what we'll be talking about this evening. Fungi are also organisms. They typically form spores. They can be organized as single cells or in masses, and we do use antimicrobial drugs to treat fungal organisms, but we're not going to be focusing on those tonight. Bacteria and fungi or germs live in and on the body and really are present everywhere on Earth. They can be really important parts of animals and humans' health as well as ecosystem health, but they can also cause infection. And so when infections occur, we use antimicrobials to treat those infections, and those are medications that target those specific bacteria or fungi. Antibiotics are the subset of those antimicrobials that we use to treat bacteria. Antibiotics are produced naturally by other bacteria and other organisms as part of a host defense mechanism, and humans utilize those antibiotics that are produced by bacteria or synthesized in a laboratory as part of medical treatment. And certainly the advent of antibiotics in medicine has been a big game changer. So they came on the scene in the 1930s and, have saved millions of lives, humans, cats, dogs, horses, fish, cattle. But because bacteria are really good at surviving, they have also developed mechanisms that help them thwart the effects of antibiotics. So that's what we're going to talk about next. And that's something called antimicrobial resistance. So antimicrobial resistance occurs when infection-causing bacteria or fungi defeat the ability of the medications to either kill them or slow their growth. So when those medications no longer work, we call that antimicrobial resistance. So those organisms have acquired or developed the ability to thwart the effects of the antimicrobial. When we talk about bacteria and antibiotics, sometimes I'll refer to that as antibiotic resistance. This antimicrobial resistance is not just something that occurs in individual patients or animals. It can actually affect an entire community or ecosystem, because bacteria that live in and on us don't always stay in and on us. They can be picked up from the environment and go back into the environment. They can be shared across communities, households, groups of animals. And so that's how, when a bacteria becomes resistant to the effects of an antibiotic or antimicrobial, then that resistance can spread not just from the individual patient, but to populations as well. Because of the fact that animals and humans live in the same environments, this is really what we call a One Health issue, because it impacts people, animals, and the environments in which they live in. So antimicrobial resistance is something that you may have heard about, when you're talking to your physician, but it's something that we care about in veterinary medicine when we're treating cats and dogs, because we see this problem in our patients. I see it in my patients, and is one of the reasons that I have become really concerned and passionate about it and want to learn more. So let's get a little bit more detail here. So over time, bacteria that are exposed to antibiotics can develop mutations that allow them to survive those antibiotics. That's called antibiotic resistance, and those adaptations can compound and develop over time. Once they develop, they can spread to other bacteria, either as the bacteria replicates or to bacteria that live on the same environment. So I'm just going to show you a really quick video that demonstrates this concept.
So what we ended up building was basically a petri dish, except that it's 2 feet by 4 feet. And the way we set it up is that there are 9 bands, and at the base of each of these bands, we put a normal petri dish thick agar with different amounts of antibiotic. On the outside, there's no antibiotic. Just in from that, there's barely more than the E. coli can survive. Inside of that, there's 10 times as much, 100 times, and then finally the middle band has 1,000 times as much antibiotic. And then across the top of it, pour some thin agar that bacteria can move around in. The background is black because there's ink in it, and the bacteria appear as white. So that there's 10 times as much, 100 times, and then finally the middle band has 1,000 times as much antibiotic. And then across the top of it, pour some thin agar that bacteria can move around in. The background is black because there's ink in it, and the bacteria appear as white. First, you see they spread in the area where there's no antibiotic, up until the point they can no longer survive. Then a mutant appears on the right. It's resistant to the antibiotic, it spreads, until it starts to compete with other mutants around it. When these mutants hit the next boundary, they too have to pause and develop new mutations to make it into 10 times as much antibiotic. And then you see the different mutants repeat this at 100. And after about 11 days, they finally make it into 1,000 times as much antibiotic as the wild type can survive. And so we can see by this process of accumulating successive mutations that bacteria, which are normally sensitive to an antibiotic, can evolve resistance to extremely high concentrations in a short period of time.
So that video demonstrates to us that bacteria, first of all, are really good at survival. And secondly, that when exposed to antibiotics, bacteria that were originally unable to survive in the presence of the antibiotic can develop mutations that allow them to live. That's one way that antimicrobial resistance occurs.
So what we ended up building was basically a petri dish.
But there are other mechanisms for antimicrobial resistant infections to occur. When a bacteria is resistant to an antibiotic, that's conferred, that resistance, that ability to survive is conferred by its genes. So it's DNA, and it can share those genes, that DNA, with other bacteria. So one way that antimicrobial resistance spreads is not just the pressure of antibiotics, but also the ability of bacteria to share those genes. And what that means is that anytime an individual receives antibiotics, there could be the development of a population of bacteria that harbor genes that allow them to be resistant to that antibiotic, even if they're not causing an infection. And they can share those genes with other bacteria in those populations, whether that's on our skin or in our gut. And then at some point, if there is some disease process that allows bacteria that are there to cause an infection. Now we have an infection that's really difficult to treat. So here's another schematic that helps us understand what's happening. This is a population on the top of bacteria that live in or on an animal. When that animal is given an antibiotic, we can see that there were already some bacteria in there that were resistant to the effects of that antibiotic. And there were some that were susceptible to that antibiotic and were killed off. And so we see now that the population of those bacteria that were resistant to the antibiotic increases, and they're allowed to replicate because now they have less competition. Whereas we have a patient here with kind of a similar diversity of bacteria, and if they don't receive the antibiotic, then there's no increase in any particular population. And what that means is that bacteria that are shed into the environment are more of the bacteria that are not resistant to the antibiotic versus in the patient that received the antibiotic. Now, what gets shed into the environment is more likely to be bacteria that are resistant to the effects of the antibiotic that that patient is on. And that's how antibiotic-resistant infections can spread throughout hospital settings, home environments, and the natural environment as well. And this concept is really important because it explains to us why the treatment decisions for an individual patient have effects beyond that individual patient. So as I mentioned, this production of antibiotics is a natural phenomenon. And because of that, the ability to resist the effects of the antibiotic is also a natural phenomenon, and it's been on Earth as long as there have been bacteria and microorganisms. And so there's a paper that explains that they can pull these antibiotic-resistant genes out of really, really old specimens. And so this is a process that happens regardless of whether we give antibiotics to patients or not. But the effect of us using these antibiotics in medicine to treat patients accelerates the onset of resistance. As we saw in that video, when we pressure bacteria with antibiotics, if we provide antibiotics into their environment, then that increases the potential of them developing mutations that allow them to survive. So we kind of accelerate this process when we give antimicrobials. And then again, once that resistance develops, then we can spread that resistance throughout the community because bacteria don't necessarily stay on or inside of us. They certainly shed. There's a study that I really love to talk to veterinary students about, and that's one that looked at the bacteria that live on people normally. That's something that we call the microbiome. So the bacteria and other microorganisms that live inside and outside of us are what we call our microbiome. And you may have heard of this in terms of, eating yogurt to improve your gut health, because eating yogurt with live bacteria helps provide a population of bacteria in your gut that's good for you. So that's our microbiome. And there's a study that looks at the microbiome on the skin surface of humans. And if there are two adult humans living in a household, they share a little bit of that bacterial community with each other. But if you add either a child or a dog into the household setting, then the bacteria that those two adult humans share increases substantially. And so that's evidence that that dog or that child helps to transmit bacteria back and forth. And so it provides us with the perspective that, individual treatment decisions are not just individual treatment decisions. We're really making those decisions with the knowledge that the effects can be beyond the individual patient that we need to treat. So that's certainly important. There are also individual things that we need to think about when we're treating a patient with an antibiotic. And so I mentioned the microbiome. The microbiome is critically important for health. So the bacteria that live in us and on us help our immune system function. So this is true of cats and dogs as well, although most of the research is in humans. There's still a lot of growing research in our companion animals. The bacteria help prevent against invaders. If there are good bacteria living in an environment like on your skin or in your gut, then it's harder for bad bacteria that can cause disease to take a hold. There have been links between the health of the microbiome and brain health, kidney health, and even behavior. Certainly in humans, there's a connection between a healthy microbiome and healthy weight and metabolism. And so those are things that we think about when we give an antibiotic, because we can affect the overall health of the microbiome, and not just the number of bacteria, but the diversity of that bacteria, and that can have important implications for overall health. So we need to use these drugs, certainly, to maintain health when we have infections that need to be treated, but we also need to make sure that we're only using them when we need them so that we're not causing other problems. So what are common reasons that we use antibiotics in cats? So the University of Minnesota Antimicrobial Resistance and Stewardship Initiative, which is part of the team that I am on, actually is studying how antibiotics are used in cats and dogs and for what reasons, to see if we can improve the way that these drugs are used. We did a study last year where we looked at antibiotic prescriptions in cats and dogs in 52 veterinary hospitals across the United States. And so this constituted about 2,600 individual animals. And among other things, we were able to determine the most common conditions for which antibiotics are prescribed. And for cats, the top two are respiratory conditions and urinary tract conditions. And then just underneath those are problems with the eyes, problems with the intestines or the gut, and then problems with the skin. So we're going to focus on respiratory and urinary tract diseases this evening. So the term feline lower urinary tract disease, or FLUTD, as we like to call it, is really an umbrella term that encompasses a number of different conditions. The reason why they're grouped together is because they often present in the same way. The signs that we see in our kitty patients are very similar because the part of the body that's affected is the same, and that's the bladder and the urethra. The urethra is the tube that exits the bladder and brings urine to the outside of the body. And so urinary stones, urethral obstructions, something that we call feline idiopathic cystitis, and we'll talk about that, as well as urinary tract infections, are all things that can affect the what we call the lower urinary tract of the cat. Kidneys are part of the urinary system, but they're part of what we call the upper urinary tract. And so when cats have problems with the kidneys, the things that they feel and the way that we recognize that disease in cats is a bit different. So we're going to focus on lower urinary tract problems tonight. So the signs of disease are common, like I said, because the part of the body that's affected are the same with all of these conditions. So the things that we might see our kitties do are straining to urinate. So they might be going into the litter box and spending a long time there and producing very little or nothing at all. We might see them going to the litter box frequently, so urinating frequent but really small amounts. And that's an indication that there's irritation in the bladder and then in the urethra. They have a constant sensation that they need to go, but there's not a lot that they can get out. Sometimes this is a painful and irritating process, and so some cats will vocalize when this happens. And we can sometimes see blood in the urine. So the absence of that does not mean that they don't have a urinary problem, but sometimes finding blood in the urine is a clear indication that there's something going wrong there. And then their behaviors will change, and we can see them going outside the litter box, so not using the litter box properly. And the reason why that typically happens is because if it's painful or uncomfortable to go to the bathroom, the cats will associate that pain and discomfort with the litter box and try to see if going somewhere else will make it feel better. We know it doesn't, but sometimes those patterns can start up and can be difficult to retrain the cat to use a litter box because they don't really trust the litter box as a place that is not comfortable for them. So urinary stones can form in the bladder, and they can cause a blockage of the urethra and an inability to urinate, or they can just kind of bump around in the bladder and cause irritation. So the stones form from minerals that are present in the urine. And minerals can form big stones. So there's an arrow that's pointing to kind of a faint round stone in the middle of this cat's bladder. To orient you, what you're looking at in the back here is the cat's pelvis and its tail. These are its hind legs and its knees. This is the bladder. And then this is the stone, and the kitty's head is way up on this end, kind of off the page. So stones can form, or minerals can form really, really tiny stones that are more like sand. And both of those things can cause obstruction in the urethra. And larger stones can cause irritation even if they don't exit and block the urethra. These stones typically form from minerals that precipitate out in highly concentrated urine. So the analogy that we often use is like trying to stir a bunch of sugar into your iced tea, for example. And you can add some sugar and stir it around and it'll dissolve. But if you keep adding more and more sugar, eventually it'll get to a point where it won't dissolve and it precipitates out and we can see the crystals. And this is exactly what happens to minerals in the urine, especially when the urine is really concentrated and doesn't have a lot of water in it. The example with the iced tea would be if you have a bunch of sugar that's sitting at the bottom of the iced tea and you stir it and it won't go in. If you add more iced tea and you stir it, then those sugar crystals dissolve. So when urine is really concentrated, those crystals don't dissolve and they actually form in the urine and they can glom together and cause stones. So this can happen, different types of stones can be related to different diets that cats are on. If cats are dehydrated, and their kidneys are functioning normally, then they're going to try to not lose water in their urine. And so the urine will be really concentrated. So when cats are dehydrated, we can see really concentrated urine and those minerals can precipitate out. The pH of the urine can also affect that. And so all of these things can together increase the risk of a cat forming stones. So what would you notice if your kitty had urinary stones? Well, if the stones are in the bladder, you can see bladder irritation. So we might notice things like straining to urinate. We might see blood in the urine, and we could see change in urinary behavior like peeing outside of the litter box. If a stone or that sand gets into the urethra and obstructs it, then that's an emergency situation. And what you would see is a cat that's unable to pass any urine despite going into the litter box. They might be lethargic and not feel well. They could hide. You might have a kitty that's vocalizing. Male cats are more at risk for obstruction of their urethra from stones or sand. And the reason why is that their urethras they're longer, but they're also thinner. And so it's harder for stones to pass through them. And so it's most of the time male cats that get into this emergency situation if they have stones that block their urethra. So how do we treat these stones if they occur? Well, if the stones are in the bladder, depending on the type of stone, sometimes a diet change is all that we need to do to dissolve stones. So if we change the diet, that changes often the pH of the urine, and that can be enough to break those stones up, dissolve them, and then eventually they'll get peed out. Increasing water, just like adding more iced tea to the cup, is another mechanism by which we can treat these and prevent them from coming back. But if they're causing a significant problem, and certainly if they're causing an obstruction, then we need to remove them. If they're a type of stone that can't be dissolved with a dietary change, then they also need to be removed. And there's lots of different ways to remove them. The first thing to do is, if there's an obstruction that you're concerned about in your cat, then bring your kitty in to an emergency service. And what the veterinarian will do is to put a catheter into the urethra and try to unblock that obstruction so that we can get urine out of the bladder. But ultimately, we'll need to remove that stone so it doesn't re-obstruct the urethra. And there are ways that can be done. If it's a stone that can't be dissolved with diet, then the things that can happen to remove the stone are surgery. So surgeons can go in and remove stones from bladders, and there are also other mechanisms that can, in certain animals, be used to remove stones, like lithotripsy, which is a laser that can break them up. Not in male cats, they tend to be too small, but in female cats, that's something that can be done. So prevention of these stones, like I said, often is increasing water intake. So again, like adding more iced tea to the glass. So increasing water intake, and that might look like feeding a canned food diet to your cat. Certain diets are helpful in preventing stone formation. And those are things that, if you have experienced that with your cat, then talk to your veterinarian about, because they'll have real specific recommendations about diet. Okay, let's talk about feline idiopathic cystitis, because this can look similar to a urinary tract infection, but has really nothing to do with bacteria. It's the most common cause of lower urinary tract disease in cats that are less than 10 years old. And so this is something that we encounter commonly. And again, the signs are really the same. What you would see your cat doing at home is straining to urinate. You might see blood in the urine. You might notice that the cat no longer wants to use the litter box. With feline idiopathic cystitis, we can have urethral obstructions, and that's because the mucus that lines the bladder, when the bladder is irritated, the bladder lining will make more of it, and that can actually cause a plug or obstruction, and that would be, again, an emergency situation. What causes this feline idiopathic cystitis? Well, if any of you have taken Latin, then you'll see the root of that second word is idio, and that means kind of like ignorant. We don't really know. It's a mystery. So we know that feline idiopathic cystitis, or FIC, is associated with stress and sometimes dietary change, but we know more what we can do to try to prevent it than we know what actually specifically causes it. But we do know that bacteria are not part of the disease process. So giving antibiotics won't help in this situation. And in fact, trying to medicate a cat that doesn't need to be medicated can actually cause more stress. So the mainstay of therapy for feline idiopathic cystitis is really to reduce stress for the cat. That can be accomplished in a number of different ways. So one is to provide pheromones. So pheromones like Feel Away can be, you can get them at PetSmart or other pet stores, and they are provided in things like plugins, like a Glade plugin, but with feline pheromones. And those pheromones help to relax the cat. And they really do have a physiologic effect of decreasing anxiety in these cats. Other things that decrease stress is to provide a place for the cat to be alone and to feel safe. And so that can be, a separate room for the cat, elevated spaces. Cats really like to be up and above things. So if you have a cat that is not really old and able to jump, what they would appreciate is to have a space like a cat tree where they have the ability to get up and above what's happening on the ground. Environmental enrichment, so having things like scratching posts and toys can be really helpful to reduce stress in cats. Removal of stressors, and sometimes the particular stressor is really obvious. So, you know, a bunch of people came to visit for a holiday party, or the cat was left at home while the pet parents left town and somebody else was watching the kitty over a weekend or a holiday. Those are more obvious stressors, but there can be stressors that are a little less obvious. So simple things like not having enough litter boxes to access can be a stressor. And so the rule of thumb typically is to have a litter box for each cat plus one, and make sure that you have one on every floor of the house so that's easy to access. My cats would prefer to go urinate in one litter box and go put their stool in another litter box. So they, you know, cats are funny. And so providing them with the resources they need can help reduce their stress. We've certainly encountered cats where they are stressed by the squirrels outside of the window. And so just closing the drapes was enough to decrease the stress the cat was experiencing. So noticing what things your cat reacts to in the environment may help you find what is causing the stress. What are the things that we can do to treat this? So in addition to reducing stress, there are other specific interventions. So canned food can be helpful here again, and there are particular veterinary prescription diets that are shown to decrease the frequency of feline idiopathic cystitis. So one is Hill's CD feline multi-care stress diet, and that will help also prevent stones that we talked about. And so talk to your veterinarian about things that can decrease stress, not only things that you can do and provide in the environment, but also dietary interventions. Okay, so we talked about a couple of things that can look like urinary tract infections on the onset and are both more common than urinary tract infections, particularly FIC and particularly in young animals. But now let's talk about urinary tract infections, because this is a condition where we do need to provide antibiotic therapy. So the normal bladder and urinary tract has defenses that protect against infection. Those are things like having a low pH of the urine, having normal bacteria in the urine that prevents bad bacteria or pathogens from causing disease. So once again, we I think are familiar with the good bacteria that is in our gut. We know that we feed that when we eat fiber and we eat yogurt, but there's bacteria actually even in the bladder. It used to be that we thought that the bladder was a sterile environment, but that's actually not true. And there are bacteria that live there, good bacteria that help maintain the health of the bladder. There's mucus that actually lines the lining of the bladder. There's a little mucus layer that prevents bacteria and other irritants from actually contacting the surface of the bladder wall. So that's a protective mechanism, kind of like the mucus in your nose. Antibodies are in the lining of the bladder too. There are immune cells there that can produce antibodies. Just urinating, getting rid of anything that's an irritant in the bladder and washing away bacteria that might be kind of creeping up the urethra into the bladder is another defense mechanism. And concentrated urine is also a defense mechanism about that prevents bladder infection, because bacteria don't like to live in really, really concentrated urine. When these things get altered, then we increase the chance of an infection occurring. Diseases that affect the ability to concentrate the urine, like diabetes, for example, kidney disease, are things that could increase the risk of urinary tract infections. Antibiotics that alter normal bacteria flora can increase the risk of a urinary tract infection sort of down the road. Anything that traumatizes the bladder wall, like stones in the bladder that are bumping around in there and irritating the bladder wall, are things that can increase the risk of infection. So urinary tract infections are not common in cats under 10 years old. So really, if we're seeing clinical signs of lower urinary tract disease in cats that are younger than 10, we should be thinking first of feline idiopathic cystitis. It doesn't mean that infections don't happen in younger cats, it's just not as common. So we can't say that an infection isn't there just because of the age of the cat, but we need to consider what's more likely first. Other causes of urinary signs, like I mentioned, FIC and stones are more common, particularly in young male cats. So if you have a male cat that's under 10 years old, we should be thinking about feline idiopathic cystitis as the cause of the signs we're seeing. Female cats, and in particular older female cats, are more at risk for infection. Females have a shorter urethra. It's easier for bacteria to kind of crawl up the urethra and cause problems in the bladder. So in female cats, infections are more common, and particularly when they get older. But if you have a young cat, the first thing that we should probably be looking for are things like stones, so doing x-rays of the bladder and considering whether or not there's any environmental changes that we need to implement, or dietary changes we need to implement if we suspect a cat has feline idiopathic cystitis. If we do diagnose a urinary tract infection, particularly in a younger cat, then we really need to look at what are the risk factors. Why is this cat at risk for this infection? So endocrine diseases like diabetes would be one major thing that we would look for. So how do we treat a urinary tract infection? Antibiotics. So certainly if we have a bacterial infection, we want to treat with antibiotics. But the good news is that we only need to treat for most infections for 3 to 5 days. So not that long. When I went to veterinary school, we treated these for 14 days, and new research has come out that tells us that we don't need to treat for that long. So that's the good news. It can be hard to get antibiotics in cats, but we can use liquids and flavored medications that make it a lot easier. Many of you may have had a cat that has been treated with an injectable antibiotic, so a shot, called Convenia, and this drug lasts for 14 days, and so it can effectively treat infections without ever having to give a pill to a cat, which that seems really great, but there's problems with that. And a couple of the problems are that if we only need to treat an infection for 3 days and we're treating instead for 14 days, think about that agar plate video of the bacteria developing more and more mutations over just 11 days. So we're putting our kitties at risk for the potential development of bacteria that are resistant to antibiotics if we treat them with an antibiotic course that's longer than they need. This drug is also not necessarily the best for lower urinary tract infections because of the way the drug works. It doesn't necessarily achieve really high concentrations in the urine, and it's definitely not one of the recommended drugs that we use first line for urinary tract infections. Despite that, it's used pretty frequently. And so in the studies that we've done, about 26% of cats that were treated with an antibiotic received Convenia. Okay, so another thing that you need to be aware of is that there's a phenomenon called subclinical bacteriuria. That's a mouthful, but what it means is that there can be bacteria in the urine, even bacteria that we can culture from urine when we do bacterial culture and susceptibility testing, but it doesn't necessarily mean that there's an infection. So the presence of bacteria doesn't mean that there's an infection that we need to treat with antibiotics. If there are no clinical signs associated with the bacteria in the urine, then it's called subclinical and not really an infection at all. And this is the case in about 13% of healthy cats. They just have bacteria that we see in the urine and it's causing no problems. So what do we do about it? Well, really nothing. We don't need to treat those with antibiotics. And this is a phenomenon that occurs in people as well. It's more common in people with diabetes and other endocrine diseases. And in people, the recommendation is not to treat the bacteria in the urine if there are no clinical signs associated with it, so there's no discomfort. unless that human is pregnant or going to undergo surgery of the urinary or genital system. So this is something that we have adopted in veterinary medicine as far as recommendations, and so we don't treat these. But there are some areas that we're a little bit unsure about, and that's if there are certain cats that are more at risk for spread of that bacteria to other sites like the kidney or into the bloodstream. So if the recommendation would be is if we think there's a really high risk, then we would probably treat the bacteria. The problem is that we don't necessarily know what high risk really is. There have been studies in cats that show that if we don't treat bacteria in the bladder, in cats, we don't see any increase in morbidity or mortality. So cats do just fine if we don't treat it. So the recommendation is to leave it alone unless there are complicating circumstances. And a complicating circumstance might be if a cat has diabetes, for example. Okay, so in the last few minutes, we're going to touch on respiratory conditions. And so we're going to spend most of our time talking about upper respiratory infections, but I did want to just briefly talk about feline asthma or bronchitis and pneumonia. So just like the urinary bladder, there are normal defenses that help prevent infection in the respiratory system. So in the nose, there's these kind of scroll-like bones that are lined with tissue that help humidify air as it's coming through and trap things like smoke and other dust and particulates and prevent them from getting into our lower airways. So mucus traps those, and then if those particulates get down into the lower airways, like the trachea and the airways down in our lungs, we also have a mucus layer that traps those things. And then right underneath that mucus are these cells with kind of like hair-like projections, and they act like an elevator or an escalator, and they move all that stuff up and out, all the way up the respiratory tree to the back of the throat so that the cat can either cough it out or swallow it. We also have immune cells in our airways that help prevent infections and attack invaders. And then just the act of coughing and sneezing and removing anything that gets stuck in the nose or in the upper airway helps remove anything that we don't want there. But anytime those systems are compromised, then we're at risk for infection. So upper respiratory infections are pretty common in cats. And the things that you would notice are things like sneezing, snotty nose, decrease in appetite. Most of the time, it's a virus that causes this and not a bacteria. But because of that inflammation, we can have a complicated situation where the virus causes disruption and bacteria that are already there can overgrow and take advantage of that situation. So the question is, when do we intervene with antibiotics? We know that most of these infections are due to a virus called feline herpes virus. In fact, about 50% of all upper respiratory infections in cats are from feline herpes virus, and almost all cats have this virus, about 90% of cats. Most of the time, cats aren't affected, and it can be a difficult thing to diagnose because when it's not causing trouble, the virus kind of hangs out in the nerves, and so it's difficult to get a sample and know what you're dealing with. So a lot of times we're guessing. But during stressful times, herpes virus can flare up. So when a cat's stressed, their immune system is not holding that virus at bay. And about 4 to 12 days after that stressful event, we can see a flare of herpes virus, and we'll see things like a snotty nose, nasal discharge, maybe weepy eyes, sneezing. Most cats will recover from that on their own in about 1 to 2 weeks with some supportive care at home. So when do we need antibiotics? Well, only if this has been going on for more than 10 days. If it's been less than 10 days, if the discharge from the nose is clear or white or even kind of opaque yellow, but they're still eating a little bit, then we usually don't need to intervene with anything besides supportive care. So what is supportive care? Well, things like warming up the food. Cats really like to smell what they're eating, so warming up food can be helpful. Adding some tuna juice can be helpful to increase their appetite, but we can provide appetite stimulants if needed. Humidifying the air. So when you take a shower, have your kitty in the room so they can breathe that humidified air, or get a humidifier for your home. And then reducing stressful things that will cause kind of the flare-up of this herpes virus are things that we can do. Antibiotics definitely are needed if we think that bacteria is complicating this viral infection. And that typically is when the clinical signs have been going on for more than 10 days, or if even before 10 days, kitties getting worse. If the nature of the snot is like brown, bloody, or really green, then that can be an indication that there's a bacterial infection that's complicating things and we need to treat, or if the appetite is bad, even with supportive care. The antibiotics that we typically choose are things like doxycycline or amoxicillin. And Convenia, again, seems like it would be a really great answer because it's one shot. You don't have to give pills to your cat that's already feeling yucky in their face. But there has been a study looking at comparing different antibiotics to treat this condition, and doxycycline really was the best. It improved nasal and ocular discharge, so discharge from the nose and the eyes, better than the other drugs tested, and both doxycycline and Clavamox improved the sneezing the cats were experiencing better than Convenia. The one caveat with that antibiotic is that we do need to provide water after we give that medication to make sure it gets all the way down to the stomach and doesn't cause any irritation of the esophagus. There are certainly situations where cats have upper respiratory infections that just don't go away. And it's most often our kitties that are more smush nose. When they have chronic infections, then they get breakdown of the normal scrolly bones in their nasal cavity that act as protection. And so they're chronically at risk for repeated infections. And in those cats, we do need to manage them with all of that supportive care that I already talked about, humidifying the environment, but they may need intermittent courses of antibiotics. And the key for those is to keep those courses of antibiotics as short as possible, just to relieve signs, and then stop it as soon as they're feeling better, because we know we're likely going to have to use it again in the future, and we want to reduce the risk of a resistant infection. So feline asthma and bronchitis are inflammation of the lower airways, so not the nasal cavity. We're moving farther down. And the things that cause the disease are inflammation of those airways, increased mucus production, which can block the airways and make it hard to breathe. And then with asthma, we can actually have spasming and constriction of the airways because the muscles around the airways tighten up. Triggers for these conditions are things like allergens, pollen, dust mites, mold, grass, and then irritants in the environment like cleaners, candles, smoke, air fresheners. So anything in the environment that might be causing irritation can worsen the condition. Things that you would notice your cat doing is having a difficult time breathing, stretching out their neck, kind of crouched position, not stopping play because they're having a hard time breathing. We can see coughing and wheezing. Cats may open their mouth to breathe, or they could be breathing really shallowly and rapidly, or even using their abdominal muscles to breathe. How do we diagnose this? Well, x-rays are really the mainstay. If we can, we want to sample the airways and look at the type of inflammation that's there. And we also want to check and make sure it's not something caused by lungworms or heartworms. So some infectious disease testing is often done. How do we treat it? Steroids. Steroids are drugs that suppress the inflammation and the exaggerated immune response, and we can give them either orally or we can give them inhaled with a special contraption that we can use with a steroid inhaler. We can use drugs that open up the airways called bronchodilators, and we use them just when a cat is having an asthma attack. We typically don't use antibiotics to treat asthma, but we might, again, if the inflammation disrupts the normal defense mechanisms in the lungs such that the bacteria that's there can kind of take advantage and overgrow, then sometimes we do need to treat these cats for what we call a secondary bacterial infection. Ideally, the way that we would recognize that's there is to get a sample of the fluid in the airway. But sometimes if a cat's not getting better with normal treatment, we might suspect that's going on and provide a short course of antibiotics. And the last thing I just wanted to talk to you about quickly is pneumonia. Cats don't often get pneumonia. It's a really uncommon condition in cats. And pneumonia is inflammation and infection of the lower airway, so actually the lung tissue itself. When we see it happen, it's usually either because in young cats, kitties, they have a virus that causes inflammation in the lungs, and then we can get a bacterial infection on top of that, or due to aspiration or inhalation of stomach contents. And that could occur after vomiting or after anesthetic procedures. So not very common, but what I wanted to talk to you about in terms of bacterial pneumonia is that in addition to your cats often needing hospitalized care so they can get IV fluids and we can humidify the air, they do need antibiotics. The major change in the way we treat these is that we used to treat bacterial pneumonias with 4 to 6 weeks of antibiotics. And there's some recent studies that suggest, at least in dogs, that we probably only need to treat for 10 days. And so that's likely true in cats. The exception would be one particular bacteria called Mycoplasma, where we might need to treat for 3 weeks. So the course of antibiotic therapy, again, is shortened below that to the time that is as short as possible to treat the infection and not so long that we're risking the development of antimicrobial resistance. So what can you do? Prevent infections. So make sure that your cats get routine checkups and their vaccinations. Discuss when your cat needs an antibiotic and when they don't. And so talk with your veterinarian about whether your cat really needs an antibiotic, and if so, which one and how long. Talk to your veterinarian about formulations that would allow you to give your cat medication successfully without having to do an injection that lasts 14 days when the treatment time really only needs to be a few days. When possible, if it's within your ability, allow your veterinarian to do diagnostic tests so that we can determine if a bacteria is there, and if so, how best we can treat it. And then the last thing is to participate in studies like we do at the Antimicrobial Resistance and Stewardship Initiative, or encourage your veterinarian to participate in studies so we can look at how we're using antibiotics, and that allows us to understand how we can improve that use. And lastly, don't flush those antibiotics down the drain or down the toilet. Bring them to pharmacies that collect medications so that they can be disposed of properly and not get into the environment. And now I'm ready for questions.
Thank you so much, Dr. Granick, for your thoughtful presentation. We have lots of questions from our audience, so we will jump right in. The first one that I have, and it's going to go back to the asthma conversation you just had, is do you have any suggestions for cats with asthma and how to treat them other than using steroids?
So that's a great question. Steroids are really the mainstay of treatment. Sometimes there can be alternative medications that decrease inflammation that can be used. But the idea is to do all the things in the environment to decrease the irritation that triggers the asthma in the first place, so that the medications that we use can be at the lowest possible dose that keeps things under control. So that's things like not using perfumes, not using air fresheners, keeping cats away from smoke, using things like air purifiers, not burning candles. All those things can be really helpful. There are some studies that have looked at providing allergy injections to cats with asthma. There's not a lot of data on it, but it looks like it could be something promising. So that may be another thing that you discuss with your veterinarian. Oftentimes that requires a referral to a dermatologist because they're the ones that provide those injections. Good,
thank you. You talked a lot about gut health earlier on, and how important it is to maintaining good health. Do cats need probiotics after a course of antibiotic to help with their gut health?
That's a super question. So depending on the age of the cat, need is the key thing. So in adult cats that have a really established population of bacteria in their gut, even with a course of antibiotics, eventually they should settle back to kind of the normal population of bacteria in their gut, their normal microbiome. We can help them along by providing probiotics, so it's always a good idea. In young cats that are still trying to develop a normal microbiome, a good healthy microbiome, they're going to be more at risk for antibiotics causing longer term disruption. And so those kitties in particular would benefit from probiotics. All cats would benefit from probiotics after a course of antibiotics, but if you had to pick and choose, if you have an adult cat and a young cat both getting antibiotics and you can only afford probiotics for one of them, give it to the young kitty because they're still developing their microbiome.
Excellent, thank you. Can cats have perpetual urinary tract infections and just kind of live with them for a good amount of time?
Yeah, but I wouldn't call it an infection. So cats can have bacteria in the urine that we can see when we look at the urine, and it may not cause any problems for them. And so, yes, they can live with that for a long time. And sometimes there could be populations of bacteria in there that that if the cat had signs of irritation, that we'd want to treat it because we think it was like an organism that can cause an infection. But if it's not causing problems for the cat, then yeah, they can live with it for a long time, and there's not a need to continually treat with antibiotics.
Good, thank you. We had a question come in, and it reminded me a little bit of the map you showed earlier that your antimicrobial stewardship team is working on in the different states. But this person mentions that they've had a lot of pets over the years that have had UTIs and kidney issues, and they're wondering about the geographic area. Is there a cause or correlation potentially with water, pollution, common chemicals, soil, or food in the environment that we live in?
So that's a fabulous question, and the answer is we don't know. But the good news is that there are folks trying to find those answers. And so one of the efforts that we have going here at the University of Minnesota is something called the Companion Animal Veterinary Surveillance Network. And so that effort is to try to collect medical records from all sorts of veterinary clinics and compile them so that we can answer those questions. We can't answer those questions without the data, and that data is sitting at every veterinary hospital in the country. And so this effort is to try to collect that data so that we can actually examine it and see if there are any risk factors or associations between either foods, environmental locations, other disease processes that put animals more at risk for things like chronic kidney disease, for example.
Thank you. This question just came in a few moments ago, and a person is asking, is conjunctivitis a type of URI, upper respiratory infection, or is there a correlation with it?
Yeah, so a lot of cats with upper respiratory infections caused by viruses like herpes virus. There's another one called feline calicivirus. In addition to affecting the nose, they often also cause inflammation of the lining, the conjunctiva, or the lining, the tissue in the eye. And then we can see things like crusty eyes, weepy eyes, red eyes. So those two things can go together. Cats can have inflammation or conjunctivitis, inflammation of the eyes, for reasons other than those upper respiratory infections. So if that's the only thing you're seeing, things like ulcers or other things, other things that irritate the eye can be occurring. Things inside the eye there can be problems inside the eye that manifest the same way. So if you're seeing that, it's always best to get your kitty checked out by a veterinarian. But absolutely, if they're snotty in their nose and they're crusty in their eye, that's usually the same condition causing both.
Good. Thank you. What should we watch for at home to determine if an antibiotic might be causing harm to a cat or dog?
So there can be some immediate things that we see if an antibiotic is causing a problem. So those might be things like vomiting, stomach irritation. We can see diarrhea, soft stool. Probiotics can help with those. But the other effects that we can see, negative effects of antibiotics, might be things that we don't see right away. It could be that a cat gets treated for maybe an infection they really need to be treated for with a course of antibiotics. And then, 6 months down the line, they develop, say, a urinary tract infection with a bacteria that's more difficult to treat. So the effects of antibiotics are not always obvious at the outset. Sometimes they can be things that we see later on.
Good. Thank you. I think we have time for just one more question. Is there anything we can do at home to prevent urinary or upper respiratory tract infections in the first place?
Yeah, so for upper respiratory tract infections, the things that we talked about that decrease stress for your cat can be really helpful in preventing flare-ups of those upper respiratory infections. Also, decreasing irritants in the house, just like we talked about for feline asthma and bronchitis, can be helpful. To prevent urinary tract infections, I think the main thing is to bring your cat to your veterinarian sort of on a routine basis to make sure that they don't have conditions that put them at risk for those infections, like endocrine diseases like diabetes, for example. So getting their overall health checked out to make sure that they don't have risk factors that make them more susceptible for infections in the bladder can be helpful.
Perfect.
Drinking water can be helpful too.
Awesome. Thank you so much, Dr. Granick.